The Spoke City Orthopedic and Therapy Center is facing many challenges that impact patient confidence and is slowing recovery progress. Recent feedback highlights within the company show concerns such as unclear communication between patients and therapists, worn or unsafe therapy equipment, and anxiety about re injury during the treatments. This proposal introduces targeted improvements such as adopting a digital communication platform for more clear and precise exercise guidance, as well as upgrading equipment through an industry leading partner to make patients feel safer during these exercises, and creating personalized exercise plans to build patient confidence. Together, these solutions aim to strengthen communication, enhance safety, and support faster, more effective rehabilitation for every patient.
Okay, so the first problem we noticed was therapists giving inconsistent communication. Basically, one therapist would give a patient certain directions and another therapist would give that same patient different instructions. So basically, it was leaving the patients like confused about their exercises, and it's like causing their progress to slow down. Other impacts it has is it's a bad look on the clinic. Also, it'll leave the patients unhappy since their progress is being slowed, and it could also cause them to like re-injure themselves.
The chart indicates that most patients had a low to moderate understanding of their exercises, with 65% rating their understanding as 1 to 3 and only 33% rating it as 4 to 5. This highlights a need for improved communication between therapists and patients.
Our solution was basically a communication system throughout the clinic. So basically, therapists can provide strict details about exercises, making it simple for the patients to understand. Um, an outcome that this would have, it'll decline patient confusion and also better looks for the clinic, basically better reviews, and also easier communication throughout the clinic.
Up-to-date and well-maintained equipment is an important part of any recovery. If the equipment is old or worn down, it can present a risk to those who are already injured. This can lead to an unsafe environment for patients and increase the cost of repairs if the equipment is outdated or severely damaged and require a full replacement. By using old and worn down equipment, this can make patients look for a better center for recovery, affect the center's reputation, and face lawsuits if the equipment randomly breaks during usage.
For problem 2, this chart shows employees that have experienced equipment repair. Even though the charts show higher levels of employees that have not experienced equipment repair, 20 out of the employees had experienced repairs during their time working there, which is high and could potentially be a danger for the patients.
Equipment maintaining isn't cheap, so to solve the problem of keeping equipment well maintained, funds need to be raised. This will require the center to keep money on the side to focus only on equipment repairs and maintenance. This way, the equipment will be lower in repair costs and prevent patients' harm at the same time. Workers of the center should also report any damaged or about to be damaged equipment as soon as possible. This will allow the company to know which equipment needs to be marked as unusable and what needs to be ordered. These steps will help improve the patient safety, reduce liability of potential risk, and create a better reputation for the clinic.
Problem number 3 is many patients experience pain during rehabilitation workouts. Why this happens? First, fear of re-injury causes patients to become overly cautious. Secondly, previous injuries create mental barriers that limit movement. Lastly, athletes returning from sports injuries are especially vulnerable. Why this is a problem? Working out with pain can worsen injuries. Patients may lose confidence in the clinic's guidance, and negative outcomes reflect poorly on the clinic, especially given its athletic reputation. The impact of this problem: slower return to sports for athletes, higher patient anxiety, and potential decrease in clinic credibility.
The chart illustrates the patients who underwent ACL reconstruction reported their highest levels of pain and fear during rehabilitation, with 16 out of 21 patients experiencing discomfort. Following them were rotator cuff repair patients with 10 out of 19 reporting similar issues, and carpal tunnel patients with 6 out of 20. The findings suggest that more physically demanding surgeries correlate with increased fear of re-injury, potentially obstructing recovery.
Our proposed solution to problem number 3 is a structured pain communication protocol. Key components of this protocol include standard pain scale education, where doctors will inform patients on the difference between safe discomfort and dangerous pain. Secondly, ongoing pain check-ins. Instructors will ask patients about pain level throughout recovery sessions. Lastly, the integration of BTE technology. This will provide real-time biometric feedback, help patients confirm they are performing exercises correctly, and reduce fear-based pain caused by uncertainty. The expected outcomes of this proposed solution is increased patient confidence, reduced pain during exercises, faster recovery timelines, and more positive perception on the clinic.
In conclusion, we believe that the Spoke City Orthopedic and Therapy Center should aim to prioritize trust, safety, and improving patient recovery progress. The issues we discovered, such as inconsistent communication, out-of-date and high-risk equipment, and patient fear of re-injury, are issues that should be addressed with solution to avoid poor patient care and damaging of the clinic's reputation. Now is the perfect time to act. Investing in our proposed solutions of implementing a digital communication platform, partnering with BTE Technologies to upgrade to higher quality therapy equipment, and introducing personalized, forward-thinking exercise programs to rebuild confidence and reduce anxiety will not only address the current issues, but also reaffirm the clinic as a patient-centered rehabilitation facility.